All right, this is Dr. Grenier trying to review some of the internal features of the heart. So remember, our base is going to be up here. Our apex is going to be here. Our right atrium, there is that tricuspid atrioventricular valve, right ventricle. Here are the chordinae tendineae, and you can see the papillary muscles that are attaching. Here is the conus arteriosum with the pulmonary semilunar valve. And then if we slightly turn, here's our intraventricular septum, where we're going to expect those bundles and bundles branches. You can kind of see the trabecular carniae kind of motif right here. This is the left ventricle. That'll be your left atria. And so this is your bicuspid atrioventricular valve. And then you can see right up in here is your semilunar valve, your aortic semilunar valve. Remember, for your histological layers, that nice lighter pink is your endocardial layer, where your endothelial cells and underlying connective tissue are. You have the myocardium, which is that cardiac muscle and some intermixing connective tissue. And this outermost layer is going to be your epicardium, also known as your visceral pericardial membrane. You can see there's that little left coronary artery, and then up here, keeping the aorta from falling over on the pulmonary trunk, is our ligamentum arteriosum. Coming back into the right atria, you can see there's where the coronary sinus is coming in. Here's the superior vena cava, and then our inferior vena cava is there. It's not easy to see, but there's a little white, let's see if I can get it right there. There's some white tissue that's supposed to represent the fossa ovalis. Remember, that's going to close when we get into our first breath, but it was open between the intraatrial septums during the fetal development. Okay, and then we also have in that myometrium layer, remember that some of the push-throughs that are forming maybe little kind of like pimples, that's going to be your pectinate muscles. Okay, and that's some of our internal features of the heart.